Hey guys, so Dr. Truesdale back at you. Today we're gonna do a fan favorite. Last time I spent some time answering your questions in the YouTube comments. So today we're gonna do part 2 of that. So let's bring these questions on. So question number 1 from Jeffrey Erickson 6766. Why is a man more challenging? Well, that's interesting. In particular, for facial rejuvenation, some of the procedures that are done can actually feminize the face, in particular, the brows and the eyes. We have seen things like Kenny Rogers here, right? Or maybe American Idol. The reason why these people look a little bit different is because their natural masculine features are now modified, right? The brow is a little bit more arched. The hooding that they have has been taken away excessively. So even though we can remove skin and we can lift things up, sometimes the better approach is to be more subtle. So some doctors have a hard time being a little bit subtle. So the end result can be a little bit more of a feminized face. So it's really important to keep that in mind. The other reason why facial rejuvenation can be a little bit more challenging in a man is because men bleed more. We have hair on our skin, right? And that hair brings hair follicles and brings more blood flow to the skin. In general, our blood vessels, our vasculature is a little bit more robust, bigger anatomy, and therefore people can bleed more. The risk of a hematoma or blood that collects under the skin is a little bit higher in a man. So it's really important to be super meticulous when you're dealing with masculine tissues. The other reason is that our faces and just our structures overall are a little bit bigger. So there's more release involved. There's more tissue that actually has to be undermined and actually approached. Typically, it's a little bit more challenging from that perspective as well. If I have the same face in a man versus a female, usually that structure is a little bit bigger, so it takes a little bit longer, it's a little bit more work to do. The other reason why facial rejuvenation is a little bit more tricky in a man is we have beards, and those beards, those temporal tufts or sideburns, when I'm lifting the face, have to be adjusted for because I can move bearded skin here, right here onto the ear. And so it's really important in terms of designing our surgeries to keep anatomy looking normal. Overall, men and women can both have plastic surgery. It's really just a matter of it being done the right way for that particular face. Great question. So question number 2 from Lorraine Duncan 9843. She says, God bless you and thank you so much for the content. Thank you, I appreciate that. My question is, years after surgery, will the process cause the skin to break down deeper? Great question. In fact, it's the opposite. After surgery, when I lift all of the muscles in the skin up into place, what happens is the new layer, right? That SMAS layer that I lift scars into its new position. So in fact, a face that's been lifted and lifted well will actually age slower than an unlifted face. The reason why is I'm releasing everything and moving it and putting it where we want it to be. That layer then scars into its new position, which is higher. Scar or collagen, right, resists gravity, continuing to pull down. So even though you have a facial rejuvenation, you will continue to age, but you'll actually age a little bit slower. That's if it's done correctly. If the surgery is not done correctly, right, when you move everything up and it's not secured well, it could fall even further than what it was actually suspended to in the first place. So it's really important to do a really good suspension at the first go around, okay? Great question. Years later, I still expect the person to look phenomenal. It doesn't stop you from aging. It just makes you look a little bit better in the initial frame. So the question for you, Dr. Truesdale, recovery. How does that work for people who live out of town, especially when it comes to drainage bottles, etc.? How soon does a patient need to come back to your office after the procedure? Let's talk about it. Believe it or not, 80-90% of my patients come from out of town. You beautiful people are all over the world, and there's only one Los Angeles. When people come from out of town, we have a full protocol that helps people from before you arrive to after you arrive, how long you need to stay, all of it. So what we do initially is we make sure you have a nice place to stay. Typically people stay within about 30 minutes from the office. We have hotels, Airbnbs that people can stay. We will arrange a nurse to be with you for the first night if you're having a facelift. Most people stay in town for about 9 days. That's the day before surgery. You get to meet me, do the surgery. 7 days later, We then remove your sutures. Most people leave the day after that. The longer you stay in LA, the better your results will be because you'll be able to unswell while you're here in LA. If you go home, it doesn't affect the long-term results. It just means you're gonna be a little bit more swollen when you fly. So most of my patients actually come from out of town with every protocol in place to make sure that that transition in your care is phenomenal. So don't worry, we've been there hundreds of times over. So we have another question, and this question we get a lot. It's from Alexandria Felder 564. She says, what price range for facial lift neck, the whole kit and caboodle? The kit and caboodle. So facial rejuvenation surgery with me is not cheap. I am not the most expensive surgeon, but I am not the cheapest surgeon. And so it is not a cheap endeavor. Typically, when a person is looking at a full facial rejuvenation, we're including some type of facelifting procedure with fat transfer, eyelids, brow lift, who knows, maybe a lip lift. Sometimes everything is being done. So it really depends on your particular face. For a true accurate assessment, we really have to go through the consultation process. But a general rough estimate for the face and neck lift kind of starts around $50,000, right? That's with anesthesia in the operating room. Every additional procedure on top of that increases the price. So typically for a full facial rejuvenation, people are looking anywhere between $60,000 and $120,000. Sounds like a lot of money. It is, and I love you guys, and I try to make that value really worth it for you. But the thing is, I only have 2 of these. I only have 2 hands, and there are billions of people who I would love to lift your face, but I just don't have the time. You know, it's kind of like a supply and demand thing. I wish I could do every facelift. I wish I could do your facelift. I want to do your facelift, but we live in the real world with time, and I also have to spend time with my family. And so I can't be lifting faces every single moment of my life. So therefore, the price is kind of adjusted to that. So it's a little bit of a tricky question because it depends on your face and what you need. Some people, they don't need more than just their eyes done. Some people, they're not interested in having more than just their neck done. Some people, they're like, doc, take me back in time. And for that particular patient, they might need 3 procedures. For another patient, they might need 7. So it really depends. Come to my office, get the consultation, and we'll go from there. But I promise you, the value that you'll get will be worth the money. I will take great care of you, and you will look amazing. I've had a deep plane facelift 13 years ago. Do I need another? I am scheduled to have another one next month. I am now 67 and now I have jowls. What are your thoughts? Well, it sounds like you already have a surgeon. 13 years is about the average amount of time that a person, 13 to 15 years, 10 to 15 years is about the amount of time that a person would think about having the full result after a deep plane face and neck lift. So you're about in that range. So if you are having another lifting procedure, it depends on your face. If you have signs that are concerning, sometimes it's really just a little lift is all you need. Most of the time though, when I'm doing revision surgery or primary surgery, I am doing a deep plane facelift because I just think that that is a superior, more profound result. Now, if you've already had a lift before and you have minimal changes, you just want to do a little tuck, maybe you don't need the full deep plane. It really depends on your face. In general, my patients are getting deep plane facelifts. Those are revision cases, those are primary cases, air body, because air body looks better with a deep plane facelift. So I would have a conversation with your surgeon and you guys can have discussion about what might be best for you. If you want me to answer the specific question about your face, come see me for a consultation. We'll go from there. We have another question from Thomas Felix 33. Thanks for the great facelift explanation. Is there only a lower facelift possible? Under what circumstances? Absolutely there is. Classically, when people are thinking about the face, there are 3 portions of the face: the upper face, middle face, and the lower third. So it's 3. When people are talking about a classic facelift, they're really talking about a lower facelift, right? They're talking about the jowl, they're talking about the neck. The mid face is something special that not every surgeon can lift with a classic deep plane or with a classic facelift. It requires that you release the ligaments that are actually holding the cheek down and bring them up in a vertical fashion. The way that most facelifts are done, that tissue is not fully released. I like to lift every mid face when I lift a lower face, but I can change my vectoring and what tissues I choose to lift. In general, people look better when you're lifting everything together because the face ages as everything is affected by gravity. So although you can lift just the lower face, To do that, in my opinion, disrupts the normal architecture of the face, which I want to preserve. Typically, if I'm lifting a face, I'm gonna lift that face. I'm gonna lift every part of that face that I absolutely can. Now, separate from that, I can do something called a weakened neck lift or a neck lift, where I'm literally just lifting this and down. That is really not for facial tissues. I am actually cutting the layer so that I'm only lifting the lower portion. That avoids making an incision a little bit higher into the ear and into the hair so that I don't need to make a scar. But that is only reserved for people who don't have much facial laxity in the lower or the mid face. It's really just the primary goal is lifting the neck. Great question. Is it wise for a diabetic patient to do a facelift? This is a phenomenal question, and I'll tell you why. Because safety is the number one thing that we have to think about. It is not safe for any patient to do surgery unless they are safe to have surgery. Diabetic patients are at risk for two particular things: wound healing issues and infection, okay? So if a person is diabetic, that doesn't mean that they can't have surgery. It means that their diabetes needs to be well controlled and managed. Because I can tell you, if someone has uncontrolled diabetes, their wounds will not heal. I literally have seen this when I was in the hospital, when I did mission work in Africa and someone's blood sugar was just through the roof. What happens? Their incisions do not close. They have prolonged wound healing. Their scars look awful, or they get infections. Think about what diabetes is. It's where there's a lot of sugar in your blood. What loves sugar? Bacteria. Bacteria eat that up, right? They have sweet tooth. And so when that bacteria sees the blood that's really, really sugary, right? What happens is they divide. Patients who have diabetes, uncontrolled diabetes, have more infections, right? I've had very few infections in my career, but a couple of them that I've had have been people who have been diabetic or pre-diabetic. So as long as your blood sugars are well controlled, meaning you're on your normal regimen and we're making sure your blood sugar levels, your blood glucose levels are in a normal range, you are at no increased risk of infection. You are at no increased risk for wound healing issues. So it's something that we have to manage leading into surgery and after surgery, but we can do this and it's been done. I do surgery on diabetics all the time. If I didn't do surgery on diabetics, I would be half as busy as I am because it's so prevalent. Now, that being said, it's not to be taken lightly. We want to make sure you're safe. So we optimize, optimize, optimize. Great question. Dr. Truesdale has given me a fresh new take on plastic surgery. Thank you. Now I understand that the results can look amazing if the procedure is performed by someone who knows what he or she is doing. Facts, you learned well. I have 4 questions for you. Oh, okay, let's go. How many aspiring plastic surgeons have you trained to transfer your skills? This is a great question. Do you have any personal goals in this area? Guys, I need to do a whole video on this. So actually I have a doctor who I just hired and he's going to be starting soon. And I am literally transferring the magic to him. The magic wand is like a baton and I'm passing it to him. Because there's so many of you out there who love the beautiful results, I want to be able to touch you guys. And I understand I only have 2 hands, so I can't do all the surgery. I want to pass this knowledge on. So at this moment, doctors reach out to me, medical students reach out to me, residents reach out to me, fellows reach out to me, and they come and observe me in the operating room. Now, I don't do that as often as I would like to because, to be honest, when they're there, I like to teach and that slows me down a little bit. But mentorship is super, super key. This week, I already had 2 conversations with medical students, giving them mentorship, people who literally are sending me, I'm inspiring people who have me look over their medical school applications or give them some research advice. All the time, I'm always mentoring, teaching, because we have to stand on the shoulders of the people who come before us. I stood on great shoulders, so I have to be the same. I have to pass it along. So great question. I'm very excited about some of the doctors who are coming up in the ranks because they're learning some of these newer techniques. I in particular am going to be giving the magic as much as I can to this doctor who I just hired. So details about him coming shortly, but I think it's gonna be a game changer, guys. Number 2, which plastic surgeons, alive or deceased, inspire you and why? Who are some of the best plastic surgeons you know? Woo! We're getting juicy, guys. My great plastic surgery mentor actually trained me at the University of Michigan. His name is Shan Baker. Dr. Baker literally wrote the textbook on facial skin reconstruction after skin cancer. And he was one of my professors and attendings at University of Michigan. This man was a magician. And I know you guys call me a magician, but I emulate him very much. I would see him design and move around skin and make it look like the cancer was never there. His bedside manner, amazing. Literally a surgical genius. So Shan Baker is definitely my number one. I try to learn from everything that is good and throw away everything that is bad. Recently, over the last few years, there have been some really good results in the facelift world and in the blepharoplasty world. And so I will steal good things from anyone that I can find, because ultimately it's about making the patients better, right? Better outcomes for patients. When I go to a medical conference, I will try to listen to everything that people say. Sometimes I don't agree. Sometimes I'll try what they say and it just won't be as good as what I'm doing. The beauty about plastic surgery is you get to create your own jazz, and you take a note there or an instrument here, or maybe you use a new device there and you mix it all together and you make something beautiful. I have a lot of surgeons that I respect and I admire. Hopefully they would think of me as well. Have you undergone, or would you ever undergo, plastic surgery? What surgeon would you prefer? I haven't gone through plastic surgery yet, but I totally think it's in my future. In particular, the things that I would think about doing as I see myself aging are something for my under eyes. Listen guys, I know it's coming. All of the Truesdales need lower blephs. It will either be a fat transfer or a lower eyelid surgery at some point in time. I don't know who's gonna do it at that point in time. Probably the doctor that I hire in my practice, because he will have all of my techniques. The second thing is, I know eventually I'm gonna want a face and neck lift. And so that's coming in the near future as well. I guess maybe near is relative, but that's something that I would consider. It's tricky when you ask a plastic surgeon about having another plastic surgeon work on them. If you look at a lot of plastic surgeons, they need work. Like we need work. And some plastic surgeons get work done and they just look awful. And you would think, like, why would that happen, right? And I don't fully understand it, but I could tell you this, the person who does work on me will probably be either trained by me or a contemporary person who I truly and highly respect. We know the truth, right? Like sometimes you will see these results and you'll think that they're good, but I see these patients who are coming to my office for revisions from these famous doctors. And so I kind of have this proprietary information and look under the hood. And sometimes it's not all that glitters is gold. It's a tricky question. I think ultimately the person who does my plastic surgery in the future is someone who I will have seen their results time after time and time again, know that they are going to be a good doctor, take good care of me. When the time comes, we'll figure that out. I'll let you guys know. Trust me, I will put you through that experience with me. You seem to be less keen to do facelifts for men, largely due to the risk of hematoma. Can you help me understand this risk and any other risks better? What is your honest advice to men wanting a deep plane facelift? Get one. Are you kidding me? I do them. They just don't want me to show the results. Get one. The risk of hematoma is there, but I do special things for men to prevent that risk. I've done a couple in the last couple of weeks. People look beautiful. I've changed around some things recently. I'm doing a preservation style facelift, so there's less skin undermined. There's less risk of hematoma because there's less space. I'm also doing a hemostatic net in men. What is that? A hemostatic net is where I'm quilting the skin down to the muscle layers. It decreases risk of hematoma and it decreases the dead space. Dead space is potential space that blood, fluid, seroma, hematoma can collect. So if you imagine pushing down the comforter, right, then it can't expand up. It's kind of like a balloon. If you keep it sealed, you can't expand it, you can't blow it up. So that's a technique that I've recently been doing for men. And I could tell you so far, in the N of probably 3 or 4, it is a game changer. No issues whatsoever. Bruising, minor, very minimal. People look great. So if you're a man and you want a facelift, come and get some. I'll see you guys soon. Great questions.